All right, Dr. Corinne Cooley, we're excited to have with us. She received her doctorate, a doctorate in physical therapy from the University of Pacific. She completed a physical therapy orthopedic residency at Cayuga Medical Center. She's board-certified orthopedic clinical specialist through the American Board of Physical Therapy Specialists, and she provides both individual and group therapy at Stanford, where she leads a number of groups for patients who are suffering from chronic pain. And she's going to talk with us today about the intersection between physical therapy and low back pain. So please do give a warm welcome to Corinne.
Thank you, Dr. Mackey, and I would like to thank all of you for attending. I know it's not easy to take time out of your weekend to come, so thanks for taking the time and being here today. So a lot of people, I'm sure, at their point in their life have been at physical therapy, and it may have been helpful or not helpful. So what I want to talk about today is how physical therapy can be helpful for low back pain, and maybe why it hasn't been helpful for you in the past. So when patients come in to see me, they have several questions. First, they want to know, why do I have low back pain? What contributes to low back pain? Why does it hurt so much to move? How can physical therapy help me? What are you, as the physical therapist, going to do for me today? And how can I find resources to help myself? So I'm going to go through all of those things in the presentation today. So what contributes to low back pain? I think Dr. Mackey did an excellent job explaining this, and I'm going to kind of go over that again. So we know that you can have signals from the back, right? There's things that are going on in the spine that might be painful or nociceptive. But however, we also know that genetics can play a role. They can play a role how your spine's set up, and then also how pain is processed. We know that the way you move and what type of activities you do at work can actually contribute to how sore and how your back might be feeling that day. Dr. Darnell did an excellent job on talking about how you respond to your pain and how much rest you might, or how your mood can affect how your back feels. And then what activities you do in your regular life. So biking, golfing, walking, all of those things can be actually a protective role, whether you have back pain or not. And then social factors. And it's interesting to me because I specifically work with movement, right? And so those social factors, it's important to understand their role. So part of when I work with patients can be goal setting toward how are we going to get you back to doing the things you love? How are you going to get back engaged with your family, or picking up your grandkids, or going to watch your kids play soccer? So the facts about low back pain, I think you've heard this several times today, is that the degree of injury does not always equal the degree of pain. And this is important to understand because the pain experience is individual. And you can have lots of pain with small things like a paper cut. And what's important to know is that rarely is low back pain dangerous. A lot of people have back pain and they think there's structures back there that are, can be scary when you try to move. And when you go to your doctor, your primary care doctor, less than 1% of the time is the condition actually dangerous. And your doctor and your physical therapist and your healthcare providers, they should explain to you when it is dangerous and when it's not, because it's important for you to understand that it's safe to move. And the movement will actually be helpful for you. So why is movement so painful? So there are lots of reasons why movement can be so painful. And one of the reasons is actually someone may have told you initially after that, for example, that ankle sprain, or the first time you may have moved and strained the muscle in your back, to rest. And so it's important to understand that rest can actually make it harder for you to recover. It's harder for you to use your muscles again, right? It may be moving in a different way, stretching things that haven't moved in a while. And then it can be hard because when you try to move again after you've rested, it's uncomfortable and it can be difficult for you. That fear of that movement, Dr. Darnell talked and Dr. Mackey touched on this a little bit, about that those different brain pathways that are more active, they can make it so your muscles actually guard when you try to move again or bend forward. And then deconditioned muscles can actually make it so they spasm when you try to move. So those are things of how it can be hard to move again. So something that I want to talk about is how does movement actually change your brain? So we talked a lot about how the brain is more active when you have chronic pain. And I like this because when you move, motor learning happens. And this can happen so the brain lights up. So if you're going to go reach for something, the brain lights up. If you even imagine reaching for something, the brain lights up, right? Because those pathways in the brain are going to facilitate that movement. And every time you move, you bend forward, your brain takes that information and it stores it again, right? How did you get so good at writing your name? You practiced. And every time you practiced, your brain took that information and stored it again for next time. This helps restore your body awareness. So if you are resting and lying down, you're not getting that practice in. You're not getting that reinforcement that movement is safe, getting your muscles to get stronger. And you lose that awareness of where your body is in space. So I tell people this is like learning to write with your left hand, right? Practicing that movement over and over again. If you haven't bent forward in 5 years, it's not going to come naturally. You might need to practice. And going to physical therapy or working with someone like a yoga instructor, someone that specializes in movement, they can help you with that because they can give you that feedback of how you might be moving that is making it so uncomfortable. Talked about it alters the brain activity, and it actually makes your brain more efficient at moving. So I tell people, this is like if you're driving to San Francisco. You can take the back roads, you can take the 280, you can take the 101, and every time you move, your brain sets up a new way and finds a new path of how to do that. And it gets faster and faster in doing that. But only if you take it gradually and slowly and persistently. So not going and, everyone going home today and be, I'm going to move now, and trying things that are maybe outside of that realm, because that might be a little bit too much. So going slowly and maybe with some guidance. So movement can change the brain, and because I'm a physical therapist, we have to talk about tissues, right? Our body and our joints. So it can also improve the condition of your tissues. So up here, I have some pictures of different tissues that it can change related to your back. So up on the slide, I have a picture of, on the right-hand side, we have the bone. And on the right-hand side, you can see the bone is nice and structured. And that's bone that's in your spine. And that allows for compression, so it helps against compression loading. There's the other picture next to it is bone from the outside of your hip, which is not weight-bearing. And you can see it's not as nice and structured, right? It's kind of more random. And movement and walking and compression, that actually helps develop the bone in your spine to be strong. So they've done studies where, osteopenia, osteoporosis, this is when the bone is less structured and it's not as strong. And so when we take people to space, for example, or you lie in bed for a long time, you're actually taking away that movement that helps keep your bones strong. So this is something that needs to happen on a regular basis. Now, the spine is made up of lots of joints, and so I like to remind people that everyone has lots of little knees on the backside of their spine, which means, and they're called facet joints, and these joints glide back and forth. And you're just like your knees. This needs regular movement. This needs to be bent forward, and bending backward to help keep that sliding and gliding and prevent it from being stiff. So when you sit for a long period of time, like today, it might get a little bit stiff. So this is why the movement is very important. And this is not only to bone and joints, right? All of your tissues, your muscles, your nerves are made to move through tissues, right? The ligaments, the disc, all of those require a certain amount of loading to help keep you moving and doing the activities you love. So how can you restore your movement, especially when you have pain, right? One thing I like to tell patients is to have thoughts that hurt does not equal harm, right? So you've been told to rest in the past, but there's actually more right with your body than wrong. And that your back is not fragile. A lot of people come in and say, I can't bend forward. I haven't done this in a long time. It's really important that when you think that thought, your muscles are going to guard, and it is going to be harder for you to bend forward. So you need to have these thoughts maybe before you start moving that can help you move more easily. Try a variety of movement. So there's lots of ways to bend forward. I know, I had to study them all. So working with a physical therapist, someone that specializes in movement, they can help you teach you new ways. Find an activity that you enjoy. So it can be hard to be motivated to go do something. and when you have pain. And so find something that you really enjoy and make a goal, and have someone that you can have in your life that can help hold you accountable. Dr. King already gave you this opportunity today. Create a weekly action plan. It can be easy to set aside things when you have pain, and really putting it down and holding yourself accountable can make it so that those things happen every week. And then eventually, what we want to see is that you don't need that weekly action plan anymore, and it becomes a habit. Every morning you wake up and you're like, oh, I remember those stretches that I did, and I know those are helpful, and it makes it so that your day goes easier. So before we go on to the next part of my slide, I would like to provide you guys with the opportunity to do some movement today. So if you feel comfortable and you are able to stand, I would like to invite everyone to stand. And we're going to do some spine motion. And remember to stay with what you know, because you know your own limitations better than I do at this moment. So I would like you all to try. We're going to do some spine motion. So we're going to go through bending forward. And I would like everyone to make sure you have space around you. Go ahead and gently start to just bend your neck down towards your chin. And then come back up and look up. And then as you breathe out, you're going to go ahead and bend as far as you feel comfortable towards the floor. So go slow, start with your neck motion, and come on down. And just take in what you might feel. Maybe a stretch in the back of your leg. And then take a breath here. So breathe in and breathe out. And then on your next inhale, come up. So that's one way to bend forward. But try another way. So now, instead of bending from your chin first, I'd like everyone to bend their knees, make their knees a little bit soft, and kind of bend like you're sitting in your chair, and then reach down to the floor. So you're bending from your lower part of your back instead of the upper part. And then take a breath here, and then come up. So that's forward bending, but everyone knows your spine moves in many directions. So I'd like you to try some other motions. So if everyone can bring their right hand down, and go towards their right, bending across. Take a breath here and come back up. Perfect. And then towards their left, going down, letting their left arm slide down their knee. And then come back up. Perfect. And then last motions would be turning, right? We twist and turn every day when you look behind you in the car. So everyone go ahead and look over their right shoulder. Maybe look at the people behind you. Take a breath here, and then come back. Get slow and comfortable, and then go to the left. And then come back. So these are things that your spine is made to do every day. And if you're not in a movement practice now, I encourage you to find one. So you guys can go ahead and have a seat if you'd like. Thank you for joining me on that. So now that you've moved a little bit and maybe woken up a little bit, we're going to talk about exercise. And exercise is one of those things where some people just don't enjoy exercise. And how many times have you gone to the doctor and they told you to exercise? I'm sure everybody can raise their hand to that. And it's because research just shows it's so powerful, but it can be really hard to exercise when you have back pain. So I thought I'd bring up some research that can support that. So aerobic exercise can help after an acute back pain injury. So if you've had a flare-up, it can actually help with recovery. And that when you have chronic back pain, exercise can also prevent the develop of a new episode or flare-ups, and can improve the chemistry in your brain to improve your mood. So it activates all those chemicals in the brain that Dr. Darnell talked about so that your mood is higher and less susceptible to pain. If you're unsure about how to exercise, this is a really good opportunity to go talk to your doctor, your physical therapist about what type of exercise might be best for you. Maybe getting in the water, right? Walking or getting on a bicycle. All of those things can be different avenues to explore. The other thing I wanted to talk about today was myths about exercise. I've had many patients come in and talk about, I need to do core strengthening. Right, to support their back. And I just want to emphasize that strengthening one muscle by itself isn't very functional. When you move and you were bending forward and lifting up heavy items, it's not just one muscle, but your hip muscles and your back muscles that all work together, right? It's how you prepare yourself for that movement, and that moving from one muscle can be important, and then applying it to your tasks. So what is your goal? Do you want to lift your grandkid up? And how your physical therapist can progress your program to get to there. And that remembering that all back pain is different, right? So we talked about in the beginning that every person's back pain is individual, and you all have different goals that you're trying to reach. So not everyone is going to benefit from the same treatment. So understanding that some people need to be doing stretching, right? Because they're maybe a little bit more stiff and their muscles are tighter. Some people may need to do relaxation so that they can stop their muscles from guarding when they move. And some people need to do more strengthening. And so that your program, your individual program, should have a combination of those things. And having someone guide you what things that you might need to work on can help get you there faster. So what should you expect when you go to physical therapy? You should definitely expect your physical therapist to ask you questions about how your pain started and what things you can do and what you want to do. You should also expect them to watch you move and have you go through some motions not only of your back, but of your hips and the other joints around your spine, and that they might touch your back and see how it feels and ask you questions about what things you've done in the past, like maybe you've done yoga and your goal is to get back to yoga. They're also going to be talking to you the entire time. They're going to say, I see that you're moving this way. And what can you do to change your movement so that it's easier for you? If you wanted to get back to sitting at work, they might look at how you sit at work, right, and give you suggestions on how to change that. And they're going to make a plan with you, right? So it's really about what you want to do. So it should be a plan with you, not their plan for you. So making sure that your plan is reasonable, like your action plan, and that it's specific to your goals. So I did want to talk about, everyone comes in, I've had physical therapy before, and it wasn't helpful for me, right? I've been there 10 times, and I still didn't have any change. And so I want to talk a little bit about different types of physical therapy treatment. And I want to emphasize that things like ultrasound and massage, these can be helpful temporarily, but the research really supports active movement strategies that they're more effective than those, and they will be helpful for your long-term success. And that if you don't have movement or education in your session, so if your physical therapist is explaining things to you, and that when you finish, you have your exercises and you understand how to do them and why they're helpful, you may want to go back and find either a different provider or tell them, hey, I didn't understand what you said last time, right? I don't know why I'm doing this movement. How is this going to help me? And make sure you understand every session. Because the research really does support physical therapy, and there's a website, moveforwardpt.com, where they have patient stories that you can access that compare things to surgery, they compare it to other physical therapy treatments, so things that you can do on your own. So what I want to end with is that you guys have an improved awareness of where you're headed, so that you have a good understanding of, am I headed the right direction? Am I doing active treatments, right? Am I aware of how the brain works, how movement can change, how exercise can be helpful for me, and that you have a plan of how to move forward. Because the last thing we want is you to be stuck, right? And not be moving towards your goals and doing the things you enjoy. So on your action plan, I encourage you to potentially choose a movement goal. Now, there's other things that we're going to talk about today, like sleep, right? Mindfulness, and you can choose a goal towards those. It's really where you feel like you need to grow most. So I have a list of resources to help you at home. And one of those is the moveforwardpd.com, where they have stories, again, of successful outcomes from physical therapy. And then the apta.org. Now, this one's nice because you can enter in your zip code, and they will find physical therapists near you. And they will also list them by specialty. So they will list them by, oh, this person specializes in sports, this person specializes in spine, and chronic pain. Now, there's a big distinction here because, as Dr. King pointed out, chronic pain treatment or chronic back pain treatment is different than a new episode, right? You're going to provide different treatments. It's massage and ultrasound. Those things can be, there's less evidence to support those for a chronic treatment, and it's more evidence for exercise, movement, and even things like, yoga, which is my next slide. So there's also online, you can access a yoga class that my colleague created for people that have chronic pain. And this is, again, it's about 30 to 40 minutes, and it starts in a nice lying down position. So it's very gentle. You can also find a movement class through Stanford. So we have a Feldenkrais, which is a type of movement-based therapy that you're going to hear about later from Dr. Bose, as well as pain coping skills classes that Dr. King leads. So mindfulness-based stress reduction, and these classes are offered year-round, and you can access them through our clinic. I also recommend volunteering for a research study or being involved in a support group. So Dr. King mentioned the apca.org, and that there's support groups within the community. That really allows you to learn from other people that are dealing with back pain and how they're managing, and if you can use some of their skills. Okay, so thank you for your time.